Hello, my name is Brenda Ontiveros, and today we will be discussing cohort and case control studies. So the first slide, we are going to discuss what they are and the difference between them. So a cohort study is a longitudinal study that follows a research participant over a period of time. And usually this period of time can last years, even decades. And a case control study is a study that compares multiple groups of people. Typically, one of the groups has a disease or a condition, and they are being studied against another group who does not have the disease or condition. And these groups are usually similar, and the only difference between them is that one has the disease or condition and the other doesn't. And also case control studies, they can last years, but typically they are small in length. So the difference between the two are that case control studies are typically faster and allow multiple risk factors to be examined, and case control studies usually begin when the outcome is already present and they're figuring out how the outcome occurred. So a good way to think about it is that cohort studies start at exposure and go forward, while case control studies go backwards. An example of a cohort study was a study done on dementia and Alzheimer incidence rates that began in 1994 and had follow-up interviews every 2 years. The objective of the study was to provide age-specific incidence estimates for both diseases, as well as understand the connection between the diseases and the categories of sex, education level, and the apolipoprotein E genotype with onset. Cohort studies are a great method to better understand an outcome of a public health crisis or to understand how a public event impacts the community. This is useful in public health because it helps guide practitioners on how to create a successful prevention campaign to alleviate the issue. They do take time, but they are helpful in public health events such as COVID-19 or how unhealthy food impacts community members over time. An example of a case control study was a population-based study on the examination of early life influences on geographical variations in adult mortality in England and Wales by using stomach cancer and stroke rates. This was done by examining the deaths from stomach cancer and strokes in the two countries between the years of 1993 and 1995, and the decedents had to be born between January 1930 and September 1939. They were compared with individuals who matched the criteria but did not pass from either conditions. These studies are useful because they help determine if there is an association between a disease and condition and a specific health outcome. Similarly to the cohort study, it is useful in the creation of prevention programs that target the specific outcome. These studies are typically faster than cohort studies, but cannot calculate the prevalence of a disease or condition, as the samples are usually random. And this is my reference page. I hope you guys enjoyed.